There's a lot of conversation that's going on about where India's heart health is. Are Indians fit? Many seem to be going to the gym, but is heart health different from feeling healthy? Dr. Panda joins us for more on that and to bust myths on what actually constitutes a healthy heart. Dr. Panda, thank you so much for taking the time to speak to us. It's been really a pleasure to speak to you. I want to start off first by asking you about, India and the number of cases we've seen, which have been highlighted as well. Many people are going to the gym, and then suddenly you've seen cases in the recent past where some of them have tragically, suddenly collapsed and died. And that somewhere scares people. When people see these things happening to those who we consider fit, it scares people.
At the beginning, I'd like to thank you for having you on the show. Now, I totally agree with you. Being fit doesn't necessarily mean that you are cardiac fit. Now, people might be fit externally, but inside the paper, many of the people might have undiagnosed diabetes, blood pressure, other problems. Now, in addition to that, people who are so-called fit people who are suddenly dying, there are many reasons why they are dying. Number one is they might have an undiagnosed blockage in the heart arteries. Unfortunately, the blockages in the heart artery that causes this heart attack. Majority times it is not the critical blockage that causes heart attack. Critical blockages are very easy to identify. People who get symptoms, you go to the doctor and get it done. But majority times it is a minor blockage when the person does excessive exercise. Suppose you are doing a certain level of exercise, you exceed that, you try to do more than that. Then you can get into trouble, because that point of time those minor blockages can break. Second is, many of these people might have undiagnosed abnormal origin of the heart arteries. When that happens during exercise, the main pipe that is called aorta starts dilating during exercise and kinks these abnormal origin arteries, and that can cause a sudden heart attack. Third thing is, some of them might look externally very fit, but they might have an undiagnosed problem in the heart muscles. It's called cardiomyopathy. So, that is very asymptomatic. Unless you check it out, you will not know about. So, at the peak exercise, the heart can give irregular beat and can stop. The other one also, some of these patients might have a electrical rhythm disturbance. At peak exercise, the heart can suddenly throw into a irregular beat called ventricular tachycardia or ventricular fibrillation. Is something like that. You see these electrical flickers in your light. So, something like that, the heart gives a wrong signal and that can stop the heart. These are the main reason why apparently fit people who are doing regular exercise, they get a heart attack and suddenly die. So, my advice, as I told you, I totally agree that being fit or externally looking fit doesn't mean that you are cardiac fit inside.